Today's discussion is about the procedure or the techniques or the steps of evaluating a health promotion and education programs. Perhaps you have heard the name of WHO, you have heard the name of UNICEF. শুনেছো না শুনোনি? Usually what they do, apart from the government of India, different international organizations also, they provide fund for the improvement of the health or the promotion of health of the community people. So according to the fund, we start to plan our program. When we start to plan our program, before planning a program, we should know about the health needs of the community. Our objective is to meet the health needs. That is our objective, so that we can improve the health conditions of the community. So after assessing the need, we plan our program. Once we plan our program, then we implement the program. Once implementation is over, then after few months, usually 6 to 9 months, not before 6 months, and maybe after 1 year and 18 months or 9 months, we can evaluate the program for its effectiveness. Is it clear now? আমরা যখন কোনো প্রোগ্রাম ইমপ্লিমেন্ট করতে যাই, তার আগে কি প্রোগ্রাম আমরা ইমপ্লিমেন্ট করব, কি অ্যাক্টিভিটি নেব, নির্ভর করছে, ডিপেন্ডস আপন দি হেলথ নিডস অফ দি পপুলেশনস। যে ধরনের চাহিদা থাকবে, স্বাস্থ্য সম্পর্কিত চাহিদা, অ্যাকর্ডিংলি we plan our program, then we implement our program by using different methods of health promotion and education that already I have discussed. Few I have discussed. In the next class I will discuss the remaining. So with the help of the different techniques and methods of health promotion and education, we implement the program. After that, what to do? Whether it is effective or not, how we can know? To assess or to know the effectiveness of any program, we used to undertake evaluation programs. For example, suppose we are taking so many lecture classes, demonstration classes, practical classes. At the end of the sessions, what we do? We arrange examination. What for? Evaluations. Like this. This is also the same things. Okay? According to the need, we discuss. According to your need, we discuss. Simply try to understand the same thing. According to your need, syllabus has been framed. That we follow that syllabus to meeting your needs. Then we are carrying out the different types of activities, that is classroom lecture, practical sessions, practical classes, family care program. Okay? This is called implementations. Then at last we evaluate whether our teaching program, whether the program we have undertaken is effective or not. The same way, in the field of public health or health, different programs are being undertaken. What for? For improving the health status of the community. Now, whether these programs are effective or not, how we can know? We can know it by evaluating the program. So today our discussion is like this: steps of evaluating a health promotion and education program. That means how to evaluate. What are the steps you have to follow to evaluate a program? Okay. Now, so what is program evaluation? Program evaluation is the systematic gathering, analysis, interpretations and reporting of data about a program to assess its impact. And assist in decision making. That means there are two objectives. Number one, to know the effectiveness of this program, to assess the effectiveness. At the same time, we can assist in decision making for future plan of actions. Whether the program has to be changed or the methods has to be changed or it's okay. If we want to evaluate the program, we have to gather informations. Is it? What type of informations? Qualitative as well as quantitative. If you go back 20 years before that, we did not think about the collection of or gathering informations which are qualitative in nature. But nowadays, we use mixed method. That is, we collect both quantitative as well as qualitative data. So, what is quantitative data? Tell me, then I can proceed. Bolo, what is quantitative data and what is qualitative data? Jore, bolo. You may be wrong, there is no harm. You have come to learn. Bolo, এতদিন তো হয়ে গেল, এই পরীক্ষা দেবে তো থার্ড ইয়ারে। বলো ডেটা, quantitative data কাকে বলে? The data that can be expressed in terms of number. It is called quantitative data. And the data which cannot be expressed in terms of number but in terms of quality, that is called qualitative data. So, for evaluating any program, we have to gather both type of informations. One is quantitative as well as qualitative. That is, we call it mixed method approach. It collects the informations. It means evaluation procedure. Collect the informations to design or improve the effectiveness of health promotion program. Okay, we design it. What for? To know or to assess the effectiveness of any health promotion and education program. Now, steps of evaluating a health promotion and education program. Only these things is in your syllabus. Steps specifically. What are those? We can divide evaluation program into three parts. One is planning. Under planning there are 6 steps. Next one is implementations. Under implementations there are also 2 steps, and then utilizations. They are under 2 steps. Okay, one by one I will discuss today. First one is clarify the program. Second one is engage stakeholders. Third one is assess resource and evaluability. Fourth is determine evaluation questions. Fifth one, determine procedures and methods. Sixth one, develop evaluation plan. So these 6 steps are under planning. Once plan has been developed, then start collection of data. Step 7, and next, once data will be collected, you have to process the data. These 2 steps are under implementations. And next 2 steps, interpret and disseminate the results. We have to interpret the results and disseminate the results among the stakeholders. And last one is apply evaluation findings for improving the quality of health of the populations. So these are the 10 steps. If you are engaged in future as a program officer or as a program director, you have to follow these 10 steps. Say for example, You are in the job in international organizations or large organizations. As far as the health is concerned, as a program officer or as a program director, whatever may be. Okay. So you have to follow all these 10 steps for evaluating different types of health promotion and education program. So first step is clarify the program. Clarifying the program. That means what? You have to know what is the program, or rather what was the program, what was the objectives of the program, what the program intended to achieve. All these things will come under clarification of the program. It is a strong foundation for program evaluation as it assesses whether the program is ready for evaluation or not. When we are going to clarify the program, first we have to see whether the program is ready for evaluation or not. That means whether time is okay. Next, whether the stakeholders, that means to whom we will ask questions and collect information, do they available for providing information to us, or do we have the sufficient fund right now to complete our evaluations. That means clarifying the program means gathering information about the program and sharing it among the stakeholders. To plan an evaluation program, this clarification is required, or rather it is essential, because to know the goals and objectives of the program or what the program intends to achieve. That means before starting any evaluation program, we have to know in details what was the program, what things had been implemented or was implemented by whom, and what are the objectives or what are the goals of these programs, and what was the outcome of the program also. This is called clarification of program. How do you know all these things? For clarification of program, we require an executive summary. That means once the program is over, a report has to be submitted, large report, big volume has been submitted, and in a miniature form, we write a summary briefly highlighting everything in brief. That is called executive summary of the report. That is required to clarify the program, to know about the goal, objective, whatever may be, all these things. What we can know from the executive summary, because we have to know the program goal. Why? Because in evaluations, we are going to evaluate whether the program goal is achieved or not. If it is achieved, how far it is achieved? Is it 100% or 80% or 90% or 50%? So before that, what you should know? What is program goal? Goal means something which is general, not that specific, that is the goal. So for example, here the program was related to exclusive breastfeeding. Goal of exclusive breastfeeding for promoting health of infant. Okay. Program goal, improvement of the health of the infant by practicing exclusive breastfeeding. That is the goal. We have to know that, because program was implemented according to the goal. So we have to know the goal. Until and unless we cannot assess the goal. Next one is, who are the beneficiaries of the program? From the executive summary, we can know everything. Beneficiaries, not the target one only. That beneficiary means who are directly or indirectly helped by this program. That means who has got the benefit from this program? These are called the beneficiaries. Next one is what were the outcome objective. What is outcome objective? That outcome objective tells us how much of what should happen by when to whom. How much should happen to whom by when. কত দিনের মধ্যে কাদের কতটা ইমপ্রুভমেন্ট হওয়া উচিত. This is ideal one. It may not be real one. We are going in details about how we can implement the program or how much we can implement. That is process objectives. Later on I am coming. So be clear about the outcome objectives. That means it tells how much of what should happen to whom by when. কত দিনের মধ্যে কাদের মধ্যে কতটুকু পরিবর্তন, I mean change, not development. কতটা ডেভেলপমেন্ট হওয়ার কথা. Say for examples, I am giving this exclusive breastfeeding. Here outcome objectives, by next 3 years 100% newborn will practice exclusive breastfeeding. Exclusive breastfeeding বলতে ক্লিয়ার আইডিয়া আছে তো? What is exclusive breastfeeding? পিডিয়াট্রিক্স এর ক্লাস হয়নি? মুশকিল। করোনি ক্লাস না? পিডিয়াট্রিক্স ক্লাস কেউ করছো না? তাহলে breastfeeding জানো তো আবার? What is breastfeeding, that you know? Then what is exclusive breastfeeding? Exclusive breastfeeding means only, বলছো না কেন জানলে? বলো বলো বলো, নিজেদের মধ্যে বলছি, জোরে বলো। Providing or practicing only breastfeeding up to 6 months without giving or providing a sip of water. কেবলমাত্র বুকের দুধ স্তন্যপান 6 মাস পর্যন্ত, ইভেন এক ফোঁটা জলও নয়। তো আমাদের আউটকাম অফ দিস কি? 3 বছরের মধ্যে সমস্ত বাচ্চা মানে ছোট নিউবর্ন সবাই 6 মাস পর্যন্ত শুধুমাত্র বুকের দুধ খাওয়া উচিত, ওদের খাওয়া উচিত, শুড। That is called outcome objectives. Now, in order to achieve these objectives, we have to adopt different strategies, different activities, and to carry out the objectives, we require different types of resources. Next step is, first one is program goal, then beneficiaries. We have to know, we can know from the executive summary. Then outcome objectives. Next one is strategies, activities, and assigned resources. And last one, the process objectives or outputs. What is that? It's a process through which we can know, or which tells us same thing, how much of what you will do or produce, for whom, by when. ওখানে আমরা কি দেখলাম? আউটকাম অবজেক্টিভস দেখলাম 100% প্র্যাকটিস, এক্সক্লুসিভ ব্রেস্টফিডিং প্র্যাকটিস করা উচিত। আমরা এখানে কি দেখতে পাচ্ছি? ইউ সি হোয়াট ইজ ফিজিবল, দ্যাট উই ডু, হাউ মাচ অফ হোয়াট, 100 জনের মধ্যে কতজনের আমরা পরিবর্তন করব যারা ব্রেস্টফিড করবে এক্সক্লুসিভ ব্রেস্টফিডিং, কাদের? বাচ্চাদের। কখন? by next 3 years. Here we have written, দেখো, out of the 100% আমরা চলে এলাম 90% করব। 100% করা উচিত, it's ideally 100%, but it may not be possible to achieve. For the reasons we have undertaken this as an process objectives, at least 90% will practice exclusive breastfeeding by next 3 years. Sometimes we call it output. Clear now? Clarifying the program, that means from the executive summary, we can know this. Okay. First step is over. That means you as a team, you as a evaluation team now know what was the program, what was the goal, what was the objectives, who were the beneficiaries, what were the outcome objectives, what were the process objectives. Okay. Now you can plan now. Once you know that means you know who are the beneficiaries, these are the stakeholders. Okay. You have to engage the stakeholders. Until unless you can engage them, how you can assess the impact of the programs? Because they are benefited from these programs. So if you do not engage them, how you will know whether the program was effective for them or not? So stakeholder engage, you have to engage stakeholders. Who are the stakeholders? Stakeholders may be anyone, people, group or organizations who directly or indirectly benefited from the program or program organizations. Okay. Next, what to do? You have to consult the stakeholders, as it is essential to know their needs and interest from the program. But all the stakeholders may not participate right from the beginning of your evaluation program. Some you can engage right from the beginning. That means what I told you, there are 3 steps, parts, 3 parts. One is planning, next one is implementations, and last one is utilization. So when you plan the program, when you implement, plan the program means evaluation, program evaluation plan, when you implement the evaluations program, and then last one utilizations. In all 3 parts, all times you can engage few stakeholders throughout the planning, implementation and use of the evaluations. Other may be consulted just for important events or key points. Now clear? Engage stakeholders. That means first you have to clarify the program. You yourself should know about the program in details. Then next stage is you have to engage the stakeholders, all the beneficiaries. Because you know who are the beneficiaries, you have to engage them in your evaluation programs. Some you can engage right from the beginning, all these stages, planning, implementations and utilization. And some you can engage in important points. Rather, say for example, you are going to collect information only, during that time you can engage them. Now, stakeholders will. What I told you, who are the stakeholders? Stakeholders are those, maybe people, maybe an organizations, okay, maybe a large group who are benefited directly or indirectly from this program. So first, inner circle, core group. Who are the core groups? Core groups you have to engage. That means along with yourselves, there are some persons, stakeholders, you have to engage them right from the beginning. I told you, some you have to engage from the planning, implementation, utilization. They are called core groups. Then next one is involved. Who are involved? Maybe in planning, maybe in implementations, or maybe at the time of utilizations. They are called involved. Okay? And next group is supportive. They are not that much involved right from the beginning, but they support your activity, your program. They feel that this evaluation is necessary. What for? To know the impact or effectiveness of your program. Then some are in the periphery, just in the borderline. Again, we can divide first into two. One is health sectors, and is non-health sectors. You have to engage those who are under the health sectors, who are also not under the health sectors. At the same time, private organizations as well as government organizations. And last one, all the community members. So this is a stakeholders win. So you have to engage all of them if you want to know or rather assess or evaluate the effectiveness of any program. So this is the second step. Third one, assess resources and availability. That means how much resources or what are the resources available to you, whether the resources are available or not. Now it is the time to clarify the resources available for evaluation. Number one, identify resources available for the evaluations. And next one, in this stage again you have to determine whether the program is ready for evaluations. If it is not ready, then how we can evaluate? Okay. So this is the third steps. Next step. So first was clarifying the program. Second was engaging stakeholders. Third one, assess resource and availability. And fourth one, now resource is okay there. Then you have to determine what? Determine evaluation questions. What type of questions you will frame, which will answer whether the intended objective of the program was met or not. That type of question you have to frame. For example, in your examinations, questions are framed for evaluations. কি ধরনের কোশ্চেন ফ্রেম করা হয় যার মাধ্যমে we can know, we can assess তোমার knowledge, তোমাদের skill. That type of questions we have to frame here also. What type of question? Number one, select and refine evaluation question. When we do frame the question, number of times we refine, fine tuning of the questions. So first, select questions and refine the questions. All the questions will be based on about the fulfillment of the objective or assessment of the objective, whether the objectives are fulfilled or achieved or not. Next one, select the questions that are relevant to this program. Frame questions that can meet the objectives. Do not use any ambiguous word or questions. The meaning is clear. What I have written, do not use any ambiguous questions. That means, or words. One word may more than one meanings. So that type of words you should not use. Preferably, questions are positive in nature. In our program, what was the program? For example, what I told you, role of exclusive breastfeeding. Is it role of exclusive breastfeeding? So we should frame, did you, because our respondents are the mothers of children below 1 year. Okay. So we should ask or frame question, do you use exclusive breastfeeding? Rather, we should not frame these questions. Are you using bottle feeding or are you not practicing breastfeeding? Forget about these questions. Okay. So always try to frame positive questions. Next step, step 5, determine appropriate methods of measurement and procedures. How we can measure whether the objectives of the shared program was effective or not, we have to measure it. And what are the procedures that we must follow or should follow to measure the effectiveness of the program. So, both what to measure and what procedures you should follow. Okay. This includes how. That means how we will collect informations, when we will collect informations, what informations we will collect, and from whom we will collect the informations. This type of questions we should frame. This step focuses upon three key questions. Select the appropriate indicators. This step focuses three key areas. Select the most appropriate indicators for program evaluations. Number 2, collect right data at right time in the right way. And third one, consider where to collect data. So, three things you have to consider. Number 1, the appropriate indicators. Then what things you would like to measure? Number 1, how? Indicator means the objective, nothing but. Okay. Say for example, indicator means MMR, IMR, these are the indicators. Okay. Next, you have to collect the data in right time, in right way. And third one, consider where you will collect data. To fulfill these three key areas, these type of questions you must follow, or this type of question should come in your mind. Number 1, what type of data will be collected? That means what type of data will yield good results. That means what type of results, what type of data will provide you to know whether the program is effective or not. I told you that nowadays we follow the mixed method, both qualitative and quantitative. Both type of data we have to collect. Number 2, what will be measured? What things we like to measure? So, just one example. Before implementation of the program, the practice of exclusive breastfeeding was 60%. Okay. In the report, in the executive summary, we knew that after implementation of this exclusive breastfeeding program, it has been raised to the level of 80%. So, what will be measured? You have to measure that one. How much percentage of the mothers are practicing exclusive breastfeeding? That things you have to measure. Or at the same time, what things you have to measure? This is one example. Say for example, whether the knowledge of the mother has been increased. If the knowledge of the mother has been increased, then automatically attitude will be changed, practice will be changed. At the same time, we should measure whether the practice of exclusive breastfeeding of mothers depends upon other factors, accepting them. That means who are the influencers, who can influence their breastfeeding practices. Say for example, like mother-in-law, husbands, or some committee members. So that things you have to also measure. When data will be collected, time of data collection, that is also important. You will go, fine morning you will go and started to collect information. No, you have to prepare the community so that they will cooperate with you when you are going to collect information. So, according to the convenient time of the community, you have to collect data or information. Next, from whom you will collect data? Here you see, target population is mothers of infants or mothers of newborns or like that, infant. The target populations. Who are the stakeholders? Family members, husbands, fine, mother-in-law, other committee members. Okay. So, these are the stakeholders. So, you have to collect informations from all of them also. And I told you this two types of data. One is qualitative and there is quantitative. How we can collect this quantitative data? With the help of the survey. Perhaps you know what is survey? Survey means collection of information from the community by in systematic way with the help of a schedule or questionnaire, where we can collect the numbers. Say for example, do you practice exclusive breastfeeding? Answer will be either yes or no. Okay. How many children do you have? This is quantitative. Okay. And qualitative, say for example, not in terms of percentage, but the idea they percolate, the way they are practicing, these are qualitative, because we have to change the way. If it is wrong, we have to change the way, then only we can improve the percentage of practicing exclusive breastfeeding. For the reasons, both quantitative and qualitative data we must collect. Even in case of qualitative data, there are three techniques. Simply you should know. Number one is observation. Through observations, you can collect some qualitative information. And next procedure is in-depth interview. That means those who are part of planning, who are part of implementing the program, the whole area, not this program as a whole, but say for example, in case of West Bengal, if we consider this, now the meaning is clear, qualitative data and quantitative data. From whom you can collect quantitative data and qualitative data. Quality data can be collected with the help of three techniques. Okay? Key techniques. Number one, through observations. Number two, through in-depth interview. In short, we call it IDI. বইয়ে হয়তো পাবে না, একটু উঁচু ধরনের বই ছাড়া পাবে না। There are three techniques. One is observation, IDI and FGD. IDI means in-depth interview. Okay? To whom you can interview? When you will think that persons having in-depth knowledge about this program, about this concept of breastfeeding. Say for example, you can ask question to COMH, you can ask question, interview to the BOMH, PHN, assistant director. So again, leader, village leader, to whom we call opinion leaders, in-depth interview. And then next one is FGD. What is the full form of FGD? Focus group discussions. That means by focusing a certain issue, we are organized discussion sessions. Our objective is to collect data. Okay, to collect mainly collect qualitative data. Now, who will be the participant here? Representatives of the community who are directly or indirectly involved or benefited from this program. So, we can interview them with the help of focus group discussions. Specifically, in case of focus group discussions, quotable quote is very important. তারা যেটা বলবে তাদের ভাষায় কোট করে নেওয়া, because our objective is to change their behavior as far as this exclusive breastfeeding is concerned. Okay? Now, what to measure? Okay? Again, what to be measured? Number one, two types of indicators are there. One is process indicators and there is outcome indicators. Process indicator means about the process, whether the total process, whole system, the method, the procedure, the strategy we follow, that worked or not. যে প্রসিডিওরগুলো আমরা ফলো করেছিলাম কখন সেই প্রোগ্রামের যে প্রসিডিওর ফলো করেছিলাম সেগুলো ঠিক কি বেঠিক সেই জন্য সেটা হচ্ছে প্রসেস ইন্ডিকেটর। আর আউটকাম ইন্ডিকেটর হচ্ছে কি আমরা যে পরিবর্তনটা চেয়েছিলাম, the change or the development we planned, whether it has been taken place or not. Let's see in details. Two types of indicators, one is process indicators, another is outcome indicators. What is indicators? Like objectives and evaluation questions can be thought of as process or outcome both. Methods of data collections, that is process indicator. Percentage of exclusive breastfeeding practice, that is outcome indicator. Now, process indicator means the strategy that I told, just repeating, the strategy, process, etc. to be followed for achieving the objectives. Why it is required? It helps us how a program is performing or meeting an agreed standard. That means achieving the goal or not. These indicators means things like design of the evaluation program, system development, methods, procedures, and functioning of the system or implementations. Next is outcome indicator. That means desired changes. When a program was planned and implemented, our objective is to change. What change? That negative. The negative things has to be changed to become positive. For example, 60%. What I told you before implementing the program, for example, 60% of the mothers practiced exclusive breastfeeding. Okay, that means 40% did not practice. So we have to change these 40% to 0%. Then it will added with 60%, it becomes 100%. So desired change. Okay. Now, a desired change means that is the ultimate objective, to increase the percentage of practice of exclusive breastfeeding. But you see, in order to change the practice, there are several factors that influence the practice of exclusive breastfeeding. Say for example, the knowledge of the mothers, the knowledge of the in-laws, the knowledge of the community members, the attitude, then practice required to achieve program goals. Our program goal, we said that 90%. Goal was 100%. Our objective was to achieve at least 90% mothers must practice exclusive breastfeeding. It helps us to understand whether the program is achieving its desired change or not. Now, okay, fine. Evaluation questions that I told you. As far as the breastfeeding program is concerned, if you want to assess the impact of exclusive breastfeeding program, or a program was implemented for increasing the percentage of mothers practicing exclusive breastfeeding, what type of questions you should ask to know the effectiveness or impact of this exclusive breastfeeding program. Number one question, so for example, question must be relevant. Okay. Have we implemented the program as planned? We have planned the program. Is it? Have you implemented the program as planned? First was planning, then implemented. আমরা যেমন পরিকল্পনা করেছিলাম সেরকম কি রূপায়ণ করতে পেরেছি? আমরা মিন্স যারা প্রোগ্রাম করেছে, আমরা তো যাচ্ছি ইভালুয়েশন করতে, সেটা আমরা দেখছি কোশ্চেন ফ্রেম করতে। What was the program activity to achieve the goal? Hold breastfeeding coalition meeting. That means to increase the practice of breastfeeding, we have conducted meeting. How many meetings? Output 12. Breastfeeding coalition meeting by the end of this year. এক বছরের মধ্যে 12টা মিটিং আমরা করেছিলাম। number of meetings held, that is process indicator. প্রসেস ইন্ডিকেটর আউটকামটা এটা 12টা করেছিলাম। নাম্বার অফ মিটিং এলস, আমাদের অনেক মিটিং করতে হবে, কতটা? আমরা 12টা করেছিলাম। কি জন্য করেছিলাম? আমাদের এই প্রোগ্রাম অ্যাক্টিভিটির মাধ্যমে ব্রেস্ট ফিডিং কোয়ালিশন মিটিং। আর কোশ্চেন কি ছিল? ইয়েস, আমরা ইমপ্লিমেন্ট করতে পেরেছি। ইউ হ্যাভ ইমপ্লিমেন্টেড অ্যাজ উই প্ল্যান বাই ডুইং দিস অ্যাক্টিভিটিস। নেক্সট ওয়ান, ডেভেলপ অ্যান্ড ডিসেমিনেট প্রমোশনাল পোস্টার্স। বললেই তো কেউ কথা শুনবে না। ইউ হ্যাভ টু ইনফ্লুয়েন্স দি মাদার্স, ওকে, বাই ডিসেমিনেটিং অ্যাজ ওয়েল অ্যাজ প্রডিউসিং পোস্টার্স। 5 ইউনিক ভার্সন। উদার দেখো, প্রসেস ইন্ডিকেটর ফার্স্ট, নাম্বার অফ পোস্টার্স ক্রিয়েটেড, কিতনা, কত পোস্টার আমরা ক্রিয়েট করেছিলাম? হাউ মেনি পোস্টার্স উই হ্যাভ ক্রিয়েটেড অ্যাবাউট ব্রেস্ট ফিডিং? 5 ইউনিক ভার্সন অফ ব্রেস্ট ফিডিং পোস্টার্স ক্রিয়েটেড উইদিন 6 months, encouraging breastfeeding. That was the activity. Next, number of posters distributed, 500 posters, 5 unique versions has been distributed to the work sites in the community within 6 months. Number of work sites receiving posters, okay, 5 or 6. Next, produce guideline, this one, produce guideline developing breastfeeding friendly policies for work sites. That means if there is a friendly policies for the mothers who works in different organizations, what are the policies? Number 1 policy, perhaps you know, as far as the industry is concerned, in any industry where 30 women, 30 or more women are working, there must be a crèche. There must be a crèche. Do you have any idea about the crèche? No. Crèche, শুনুনি কথাটা? Nobody? Crèche, ছোট বাচ্চাদের যেখানে রাখা হয় তাকে বলা হয় ক্রেশ। সো প্রতিটি ইন্ডাস্ট্রিতে যেখানে 30 বা তার বেশি উইমেন ওয়ার্কার আছে, সেখানে একজন ক্রেশ, একটা ক্রেশ রাখতে হবে। সেই ক্রেশে বাচ্চা মায়েরা বাচ্চাগুলোকে রেখে দেবে, নার্চার করার জন্য লোক আছে। এবং মায়েরা কি করবে? ফ্রম টাইম টু টাইম উইদিন দি অফিস আওয়ার্স, দিস দ্য পলিসি, দে মাস্ট বি অ্যালাউড টু কাম ইন কন্ট্যাক্ট with the child and breastfeed their child. So that type of policy will help to increase the practice of exclusive breastfeeding. Okay. Produce guidelines developing breastfeeding friendly policies for work sites. How many? 1 guideline. 1 guideline research document created for work sites within 6 months on developing breastfeeding friendly policies. Number of guidelines. Next is conduct, not only that, conduct advocacy with MPs. We have to act as an advocate. To whom? To the political leaders, elected political leaders of that area, all MPs, member of provincial parliament, or we can say right now MP means member of parliament, তাদের সাথে মিটিং করব। কতটা করেছিলাম কিনা ডিউরিং দি ইমপ্লিমেন্টেশন অফ দি প্রোগ্রাম, কতটা মিটিং করা হয়েছিল তাদের সাথে, তাদেরকে বোঝানো কেমন হয়েছিল? বিকজ ইনডিরেক্টলি দে ইনফ্লুয়েন্স mothers to breastfeed their child by providing guidelines, by framing policies. To meeting with the member of provincial parliament in our community by the end of this year related to breastfeeding friendly policies, and in process indicators, number of meeting held with MPs. So 5th step is over. Okay, what do we measure? And next, develop evaluation. Now develop evaluation plan. What is a plan? Plan means a blueprint on the basis of which entire activity or work will be performed. That is plan. So how to evaluate, how to proceed, that is called evaluation plan. An evaluation plan is a written document. It means how we will monitor and evaluate your program. Use of evaluation results for program improvement and decision making. We can evaluate any program. How? By creating an evaluation plan. By building on information from the previous steps 1, 2, 3, 4, 5. ওই সব স্টেপগুলোতে যে সমস্ত আমরা গ্যাদার করেছি ওখান থেকেই on the basis of that ওর উপর ভিত্তি করে আমরা evaluation plan তৈরি করব. Creating an evaluation data collection matrix. How to collect evaluation data and finalize the budget also. Now, planning phase is over. This is implementation stage, steps. Step 7 and 8, implementation. Means, first is collect data. That means collection of data with the help of tools. With the help of tools that you have to prepare, as you prepare data collection tools. While collecting data, you have to specify the procedure, how you are going to collect data. Is it house to house visit? Or interview key persons? Or opinion leaders? You yourselves alone may not be able to collect data because area may be large one. So you have to employ or rather you have to deploy data collectors. Once we employ or deploy data collectors, you have to train them. What type of data you collect, how you will collect data, the procedures, everything you have to train them. Then only they will be able to collect right data. Train data collectors and then data collection will start. Once data collection is over, then question comes about processing of data. Do you have any idea from planning the program to evaluation? First what we do? We plan. Okay. Frame your objectives. Select your beneficiaries. Think about the indicator. Then prepare dummy questions, list of questions. With the help of the questions, you prepare a format. In our language, we call it schedule. You have to prepare a schedule on the basis of which you will collect information. Because if you do not prepare schedules, what will happen? Say for example, data collector. He will collect few data. Data collector second, 2. Oh, another data he may collect. But same things may not be collected. For the reasons, one schedule or format must be developed. Everybody will follow that schedule. This is a process data. Then you have to process the data. This is a technical step, nothing but. This technical step, it involves engaging with the data. That means you are always dealing with the data. That is synthesizing and interpreting information from all sources. Techniques of data collections, analysis will depend on number 1. Say for examples, those who are analyzing the data, they are experts. But again, they have to depend upon something else. Number 1, evaluation questions. If the question is not correct, that means data you will collect may not achieve the objective. Objective উপর ভিত্তি করেই যদি আমি কোশ্চেন তৈরি না করতে পারি তাহলে সেই কোশ্চেন উত্তর যেটা পাবো সেটা কিন্তু অবজেক্টিভকে ফুলফিল করবে না। For that reason also analysis of data depends upon type of questions, evaluation questions. Nextly, it is okay, it is correct, then depends upon the data collector. What type of data has been collected? If the data is wrong, procedure will be wrong. Then third one is the resource available to support data analysis. Once data analysis is completed, then start thinking how to disseminate your report to the stakeholders. Once processing is over, then next processing means what? Processing means what I should say, this classifications and tabulation of data. Classification and tabulations. One classification tabulation will be over, then question comes up about analysis. If you want to analyze the data, first you have to enter the data. Previously, we used to do in a piece of paper. Now, with the help of laptop or computer, you are entering the data. Then organize your data to enable analysis. Analyze your data, set the stage for interpretation. That is again important. Step number 9 is interpretation and dissemination of the results. Interpretation means deciding what the data mean. যে data আমি collect করেছি সেই data বলতে কি বোঝাচ্ছে, that is called interpretation, not the descriptions. What is the meaning of the data? It provides explanation for the results and attaching significance to their findings. And next one is dissemination, means presentations. Nothing but we are disseminating the results. Okay? We are presenting the results to the stakeholders. Dissemination is making information available and usable to various types of audience, to various channels or formats. Now, procedure or interpretations and dissemination. How to disseminate? Number 1, first one is, I told you what the data mean. That is interpretations. So, every data you have to interpret it in language. Then, on the basis of your interpretations, you have to prepare the recommendations, develop recommendations. We as a team member, we as a evaluation team, we are recommending these things. Next, to implement the recommendations, you have to develop yourself a communication strategy. How to communicate with the different types of stakeholders for changing their behavior. Create and distribute communication product. শুধুমাত্র মুখে বললেই হবে না। Okay? As a reminder tool, we can supply or we can provide some documentations, some communication product. What are those? Some leaflet, posters, what I told you, leaflet, posters, pamphlets, you have to distribute. And last one, apply evaluation findings to take actions. Now we have come to the final stage of the evaluations for taking actions. Reporting and disseminating may facilitate use. We are focusing on actually using the results for direct change and new thinking. Last conclusions. Evaluations helps organizations. That means আমাদের যখন organization আছে, we have the organizations, we got fund. Is it? We got fund for planning and implementing our program. So, if we can justify that yes, fund has been utilized correctly, our objective has been fulfilled. If in evaluations we can see that yes, here in case of exclusive breastfeeding, আমরা কি করতে পেরেছি? Exclusive breastfeeding practice-টা বাড়াতে পেরেছি. So evaluation helps organizations justify, support and improve programs and make other important decisions about them. Again, the same things repeating, like executive summary. To do that, we have to engage right stakeholders. Next, select evaluative questions cautiously, which are salient to those who will take action and relevant to the program in its current context. Next, what methods you will use that is relevant, and with these methods we can collect accurate data. Choose methods that will yield accurate data. Then analyze the results with great care. That means you should not, you means the team, analyze team should not commit any mistake. So share what you have learned. To whom? To the stakeholders. All these will support the best use of evaluation findings. Next, proper evaluation take time and resources, but yield good results. Adopting step by step, anyone can complete a well-designed evaluations. One that encourages beneficial action to follow. Okay? Recapitulate now without going through the slides. Evaluation means what? What is the objective of evaluation? Just I will take 2 minutes. Follow. Objective key. What is the objective of evaluation? Objective of evaluation of program? To follow. To কেন আমরা evaluate করছি? What for we are going to evaluate a program? এতক্ষণ তো শুনলে প্রথম থেকে। To assess the impact of the program. যে প্রোগ্রাম আমরা করেছি সেটা আদৌ ফলপ্রসূ হয়েছে কিনা। To assess the impact of the program. Is it? Now to do that, we have to follow how many steps? কটা স্টেপ? জোরে বলো, ঠিক বলেছো? 10টা, 10 steps you have to follow. Can one bench be able to tell one step? First step? First step? Clarifying the program. Is it? You have to clarify the program, what it was. What was the objectives? What is his goal? Okay? Next step is engage stakeholders. Third step, assess resources and availability of resources. Fourth step, frame evaluation questions. Fifth stage, select the procedures or methods. These are the planning stage. Then in implementation, 2 steps. কি step দুটো? Collect data, analyze data. 8টা আর দুটো interpretation and dissemination, and last one is utilization of the results.